Hello, teammates. As we come off the heels of Atrium Health Day, I found myself in a bit of a reflective state and wanted to take a moment to pull back the curtain and speak to you honestly about this year, what I'm most proud of, what keeps me up at night, and what I hope for when I think of Atrium's future. Now, it goes without saying that this year has been full of triumphs, turbulence, and transformation, with every chapter of our 2021 journey bringing new perspective, new meaning to our mission to improve health, to elevate hope, and to advance healing for all. So I wanted to start off with the triumphs. While I can spend hours listing off every accomplishment, success, and goal we have achieved in 2021 as an enterprise, a few particular ones stand out to me. We kicked off the year with a series of firsts in the midst of the pandemic. The first to administer a COVID vaccine in the state of North Carolina. The first to host a mass vaccination event in the entire region. The first to provide COVID virtual care delivery in the most rural parts of Georgia. And the first to distribute over 3 million face masks to the most vulnerable populations in our regions. We then made local and national headlines with the location announcement of Charlotte's first ever four-year medical school, Wake Forest School of Medicine in Charlotte, our new innovation district, and the rebranding of Atrium Health Navicent and Atrium Health Wake Forest Baptist. We also welcomed Floyd into our growing family and expanded our footprint deeper into the heart of Georgia and across the Southeast. And if that wasn't enough, as the new Atrium Health, we launched the largest philanthropic campaign in our history with the goal of raising over $500 million, of which we've already received generous commitments from individuals and community partners like Bank of America, Ally Bank, and the Tepper Foundation. To top it off, we also rolled out our new culture commitments to represent the very best that each of our legacy organizations has to offer, while enabling us to thrive as the leading next-generation academic health system in the nation. And all this just scratches the surface. Yet, as I've spent time rounding in our hospitals and our facilities throughout this year, meeting with teammates and listening to their stories, to be honest, what makes me most proud are the moments that don't necessarily receive media coverage, awards, or accolades. Those tiny moments that may go unnoticed, but have an even greater impact on our patients, our communities, and each other. Moments like when our full ICU unit at Atrium Health Union was flooded by an unexpected pipe burst. Our critical care teammates jumped into action. While still performing their rounds, they moved the ICU to the emergency room department, doing everything, anything to ensure the care and safety of our patients. Or when an elderly African-American gentleman arrived at one of our COVID testing sites and shared that he was homeless. Our teammates not only provided him with food, with cleaning supplies, and arranged for a hotel room, but one of our nurse practitioners even gave him clothes from her husband that were in the back of her car. Or when one of our own lost her father to COVID and several other health complications. Our teammates came together to raise over $500 for a few warm dinners to take care of her and her family. These moments, and many others for that matter, occur every single day within our walls and demonstrate the very heart and soul of you, our teammates. To paraphrase former basketball coach John Wooden, character is who you are when no one is watching. And I believe that the character of our teammates has never shined brighter, that the best of who we are showed up despite the roller coaster and the complexities we have faced throughout this past year. And for that, no words can describe my pride, my admiration for our Atrium Health family. You deserve the spotlight, you deserve the recognition, and most of all, you deserve a little rest. Which in fact leads me to what keeps me up at night. It's been over 600 days since our nation was first impacted by COVID-19, an unknown, unseen, unpredictable opponent that has challenged every aspect of our life. And day after day, you've been in the trenches of this battle to protect our patients, our community members, and each other. You've shown the world that not all heroes wear capes, rather they are armored with masks, with gloves, with goggles, and scrubs. In fact, across our system, since the beginning of the pandemic, you have cared for over 27,000 admitted COVID patients and discharged almost 19,000 patients. And that's over 11,000 birthdays our patients have now celebrated thanks to your dedication. While these numbers speak volumes, they're more than just numbers. They're human lives, hands that you have held, and the last breaths that you have witnessed when their loved ones could not be in the room. One teammate, a mother of 3, even shared with me, while tears streaming down her face, how she had to look in the eyes of a patient, a mother of 4, to try to reassure her that her children would be okay if she didn't make it. And unfortunately, she didn't. This is a story repeated across our enterprise every single day. So it comes as no surprise to anyone that you are tired, you're stretched, and you're emotionally drained. Please know that I see this. I see the struggles that you endure, the stress that you carry, the fatigue that you feel. And we're doing our best to alleviate some of that burden and the staffing concerns by redeploying thousands of teammates, as well as recruiting over 500 runners in the last 3 months alone, and hiring more than 7,000 new nurses since the beginning of the pandemic to help with shift demands. We've also offered over 45,000 burnout prevention activities to include code lavender interventions, increased base pay compensation, and provided financial awards for teammates across the system. Also offering well-being seminars, meditation sessions, and podcasts, which have been viewed more than 25,000 times this year. But with the end of the pandemic still on the horizon, I know now more than ever, it's hard for all of us to find the motivation, energy, and drive to continue fighting what seems to be a never-ending fight. Yet, as history would tell us, some of the hardest fights in our nation, like the storming of Normandy Beach in World War II, the March on Washington during the Civil Rights Movement, and 9/11, showed that only by standing together can we turn hope into reality. As Ralph Waldo Emerson once said, the task ahead of us is never as great as the power behind us. And that power, that strength, is each of us together. The pandemic is another hard fight in our history, but it is nothing that we can't overcome when we work together to eliminate the virus once and for all in the interest of what's best for our communities and for humankind. That's why, although it's not an easy decision to make, the leadership team and I ultimately decided to require vaccinations for employment at Atrium Health. We recognize that this pandemic is not about just any one of us individually, rather it's about community. It's about the good of all. And we're not alone. We're joined by hundreds of health systems across the country who are taking the same necessary measures, not only to protect their staffs and patients, but the communities that they serve. And it's rather simple. The more people that are vaccinated, the more herd immunity we create, and the less likelihood of COVID mutating into other scarier, life-threatening variants. The numbers don't lie. In fact, to date, 97% of our COVID patients on life support are unvaccinated. And that's why I'm proud to say that over 55,000 of our teammates are in compliance with our vaccination policy already, making Atrium Health the employer with the largest number of vaccinated healthcare workers in the Southeast. And we're 100% committed to a fully vaccinated workforce. Now close your eyes for a minute and imagine a shield with holes and cracks. Its armor is weak, and one hit may bring it to break right in half. But a shield crafted with the strongest of metals will withstand a much greater force with resiliency. So let's be that shield formed by the strongest of metals, with no holes or cracks. Let us stand more powerfully together and much stronger than any task ahead of us with COVID-19 by being fully vaccinated together. And to those of you who are unvaccinated and find yourself on the fence, I encourage you to speak to your leaders. Atrium Health is offering a number of ways to get your questions answered through educational webinars and materials, as well as through our vaccination ambassadors and experts. But what's even more powerful are the stories of our teammates who have had COVID. Listen to their experiences, reach out to them, ask them your questions. They are living and breathing proof that getting vaccinated is the right choice. While we are certainly not out of the woods yet, I firmly believe that when the history books are written and future generations learn about this global pandemic, they will see that in the darkest of hours, we took care of each other, our patients, our families, our friends, our neighbors, and we did so stronger than ever before. On that note, as we continue to forge ahead towards the end of this year, I invite you to join me in celebrating a few upcoming events across our enterprise. While we just recognized Atrium Health Day yesterday, on Saturday, we will also be reaching our 1-year milestone in our combination with Atrium Health Wake Forest Baptist. So please be on the lookout this evening as Charlotte will be painting the town teal, including its skyline, to recognize our 70,000 teammates from here to Winston-Salem to the heart of Georgia. Also tonight, we will be premiering our 17th annual Atrium Health Has Talent grand finale, with this being the first year Atrium Health Wake Forest Baptist will be joining in the fun. I encourage everyone to tune in at 7 p.m. to watch our talented teammates take the stage and perform some of the most moving and inspirational, original, and cover songs, poetry, and music. I have no doubt you will be in awe of your amazing peers, such as one of our security guards reciting an original poem, a nurse manager playing an original song about our mission, and a chair of pediatrics who is a one-man orchestra. And as we conclude yet another week, on behalf of our entire leadership team, I want to end by saying thank you. Thank you for leading the fight to overcome the obstacles that we have faced as a field, as an organization. Thank you for finding better ways to bring care to our patients and our communities. Thank you for continuing your tireless work in making tomorrow better for generations to come. And thank you most of all for living out our mission, for making it real, to improve health, to elevate hope, and to advance healing for all. We certainly would not be Atrium Health without each and every one of you. Thank you, and have a wonderful rest of your day.